Because SIADH can be caused by various factors such as cancer, CNS disorder, drug therapy, and other conditions, the first step to treat the syndrome of inappropriate antidiuretic hormone is to diagnose directly the underlying cause. Next step of the treatment is to stop or avoid medications that stimulate ADH release. Treatment of SIADH in lung cancer and hyponatremia with severe symptoms are recommended to be treated with 150 milliliters of 3% hypertonic saline over 20 minutes, and repeated until a 5 millimoles per liter increase in serum sodium is achieved, limiting the total increase to 10 millimoles per liter in the first 24 hours, then an additional 8 millimoles per liter during every 24 hours thereafter, up to the serum concentration level to 130 millimoles per liter. If symptoms are mild and serum sodium is greater than 125 millimoles per liter, the only treatment may be fluid restriction of 800 to 1,000 milliliters per day. The purpose of the restriction is to attain weight reduction and gradual rise in the serum sodium concentration and osmolality. Improvement in symptoms should present with normal level of serum sodium and osmolality. Patient may experience discomfort due to the thirst from the fluid restriction. A loop diuretic such as furosemide may be recommended to promote diuresis. This treatment is only recommended to patients with a serum sodium level of at least 125 millimoles per liter, because diuretics will promote further sodium loss. In addition, furosemide will also increase the loss of potassium, calcium, and magnesium. Thus, supplement may be needed. Dimeclocycline also will be given to block the effects of ADH on the renal tubules, resulting in a more dilute urine. Vasopressor receptor antagonists, which blocks the activity of ADH, are used to treat euvolemic hyponatremia in hospitalized patients. Conivaptan is given intravenous, and tolvaptan is given orally. Neither should be given to patients with liver disease because they can worsen liver function. Now, let's talk about nursing intervention. The nurse will observe low urine output with a high specific gravity, a sudden weight gain without edema, and a decreased serum sodium level. Monitor intake and output, vital sign, auscultate heart and lung sounds, obtain daily weight, and report weights above 1 kilogram. Observe for signs of hyponatremia, which include seizures, headache, vomiting, and decrease in neurological function. When treating patients with chronic SIADH undergoing a fluid restriction of 800 to 1,000 milliliters a day, it is recommended to offer them ice chips or sugarless chewing gum to help them with the discomfort of thirst. The nurse should use 0.09 sodium chloride instead of water to flush entire tubes and to mix medication or dilute feeding given entirely. Monitor for fluid overload, heart failure, and water intoxication by observing distended neck veins, crackles in the lungs, confusion, headache, edema, and disorientation. It is important to correct hyponatremia slowly. The level should not increase by more than 8 to 12 milliequivalents per liter in the first 24 hours. Quickly increasing levels can cause osmotic demyelination syndrome with permanent damage to nerve cells in the brain. A fluid restriction of 500 milliliters per day may be needed for those with severe hyponatremia. Initiate seizures and fall precautions if the patient has altered sensorial or is having seizure. Position the head of the bed flat or elevated no more than 10 degrees. This will enhance return to the heart and increases left atrial flowing pressure, which will reduce the release of ADH. Frequent turning, positioning, range of motion exercises are important to maintain skin integrity and joint mobility. Now, let's talk about client education. If the client is taking loop diuretics, have he or she obtained a daily weight to monitor changes in fluid balance. Also, advise them to take supplements such as sodium and potassium. Teach the patient the symptoms of fluid and electrolyte imbalances, particularly those involving sodium and potassium. While taking antibiotic demeclocycline, remember patient that it should not be taken with supplements, antacids, or milk. Monitor for yeast infection while taking antibiotic. Avoid prolonged exposure to sunlight. Contact provider if diarrhea develops. Patients treated with hypertonic sodium chloride IV fluid should report difficulty breathing, obtain weights daily, wear medical bracelets, restrict fluid intake. If experiencing tremor disorientation, it could be a sign of hypervolemia and it can lead to seizures. Do not drink alcohol.